Let's look at the advantages and limitations of zirconia. We already know that zirconia is going to be a far much more aesthetic dental implant versus titanium. We have already looked at zirconia posts in root canal treated teeth. We know we wanted to move towards zirconia rather than metal because it is far much more aesthetic and was trans-illuminable. And we also know that zirconia posts in root canal treated teeth are more expensive. So it's no surprise that zirconia dental implants will also follow suit. But the most important thing here is that it is a non-metal implant, and where a patient desires an implant and has a known metal allergy, this is probably the best chance they have if they want a fixed restoration in their mouth. Now, although we know there are many studies, the studies obviously are not as long-term compared to the ones that we have with titanium. But as I said to you before, just because we haven't had enough time to assess the product properly, it doesn't mean that we give up on this product. Most of the patients that I have, it's amazing to see a zirconia implant crown, which obviously collects much less plaque than a porcelain fused to metal crown. But interestingly, around a zirconia dental implant, I see two things. I noticed that there is the process of gingival creep, allowing the gingiva to creep up the surface of both the implant and obviously if you have a zirconia crown as well. There's much less plaque accumulation around a zirconia implant and an implant zirconia crown compared to that of a titanium. Now, I had a patient that came to me from Brunei. He had traveled both to Australia and Malaysia. That's part of his work. So he traveled those places for that reason. He ended up in Singapore, and his crown had fractured, and that's the reason why he came to see me. So when he saw me, he said, look, two dentists have really tried to put crowns on this implant of mine. It's a ceramic implant. I placed it many years ago. Before he opened his mouth, I already knew that it was going to be a small diameter zirconia implant. And that's the problem I had. So I then made a crown for him, which obviously had a huge food trap, as you can imagine, both on mesial and distal areas. I cemented it in with Rely X. And 3 years later, he came back and the same crown had fractured. Of course, he was a bruxer. Of course, patients who have all these problems are all bruxers, of course, as we obviously endure. And that's because these patients are usually in high-stress jobs. And what I had to do in the end for him was I had to remove that one-piece implant and place a two-piece implant. We all know one-piece implants have prosthodontic challenges, okay? And the instance of zirconia implants, we do not have a multi-unit abutment for all-on-4 style tilted implants. But the benefits of this, I'll tell you now, I don't see as much periimplantitis in my patients who have had zirconia implants compared to patients who have had titanium implants. Now, whether they have a reduced systemic absorption or effect, it's completely up to you whether you wish to believe or not. But I've seen plenty of patients coming through who have eczema, rheumatoid arthritis, patients who have systemic chronic granulomatous conditions, sarcoidosis, searching for someone, and they do not want to upset their immune system for this. There are many patients around the world that head towards Switzerland, very famed for having lots of ceramic implant systems, as I'm told, holistic treatment, where dentists treat the patients who will then disinfect the extraction sites with ozone and put platelet-rich fibrin. Well, we have all of this now in Southeast Asia. Let's look at the first case. This case is a case very, very close to me. Let me tell you a bit about him. It's a 43-year-old male who called me one evening and said that my tooth is moving on the bottom left-hand side. So I then saw him quite quickly. I had to see him quite quickly, you see, because he was my brother. Now, my brother has a history of grass, pollen allergies, dust mite allergies. He had eczema as a child and childhood asthma. Now, 1 year after I placed a titanium implant in him, and mind you, this implant was done as an immediate implant, of course. Tooth came out, implant went in. 4 months later, we restored the implant. 1 year after this, the implant became loose. And at that point of time, when I first had placed the implant, I did not have a ceramic implant as an option for him. But of course, come a few years later, after the involvement with that first patient I saw from Malaysia, I had already told myself that perhaps if I had an opportunity to place a ceramic implant in a patient who would fit the criteria of someone who has allergies, I would do so. And then my brother says, my implant is shaky. I think there's a problem. So as we would all do, we take an X-ray and we would assume that it's the abutment screw that is a bit loose. So we access the screw channel and we try and tighten. But lo and behold, the implant had failed. So I took out the implant and then waited for a month before going back in again. And this is the tissue response around the implant, as you can see. So that is a Zeramex P6 implant. That is the slightly older generation implant that Zeramex had. It's a very, very good implant system. But I now have a new system, which I'll talk to you about. This is the P6 system, and the new system is the XT system. And you can see here, if you look at the keratinization of the adjacent mucosa around the implant, you can see, and you will agree with me, that the tissue response is impeccable.